വെരി ഗുഡ് ഈവനിങ്, വെരി ഗുഡ് ഈവനിങ്, വെരി ഗുഡ് ഈവനിങ് ഓൾ ഓഫ് യു. അപ്പോൾ എല്ലാവരും നമ്മുടെ വെർച്വൽ പ്ലാറ്റ്ഫോം ക്ലാസ് അറ്റൻഡ് ചെയ്യാനായിട്ടിരിക്കുകയാണെന്ന് വിചാരിക്കുന്നു. സോ വൺസ് അഗെയിൻ നമ്മുടെ ആ പരിചയപ്പെടുത്തലൊക്കെ ഒന്നുകൂടെ ഒന്ന് ചെയ്തേക്കാം. അപ്പോൾ അഭിലാഷ് വിജയമോഹനൻ, സീനിയർ ഫാക്കൽറ്റി ഫ്രം OET ഫാമിലി. ഓക്കെ, സോ ഐ വിഷ് യു ഓൾ എ വെരി ഗുഡ് ഈവനിങ് വൺസ് അഗെയിൻ. അപ്പം നമ്മുടെ മാവേലിക്കരയിലെ ഇപ്പോഴത്തെ സിറ്റുവേഷൻ എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ, പൊതുവേ കേരളത്തിലെ എല്ലാ സിറ്റുവേഷൻ എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ ഇറ്റ് ഇസ് ഹെവിലി റെയിനിങ്. ഇറ്റ്സ് റെയിനിങ് കാറ്റ്സ് ആൻഡ് ഡോഗ്സ് ഒന്നും ഒക്കെ വേണമെങ്കിൽ നമുക്ക് പറയാം. ഭയങ്കരമായിട്ടുള്ള മഴ. അപ്പോൾ നമ്മളെ കാണുന്നവരെല്ലാം എങ്ങനെയാണ് എന്നുള്ളത് നമുക്കറിയത്തില്ല. അവിടെയൊക്കെ മഴയുണ്ടോ? ഉണ്ടെങ്കിൽ നിങ്ങൾ എന്തെങ്കിലുമൊക്കെ നമ്മുടെ കമൻസിനകത്തുമൊക്കെ ഒന്ന് ചെയ്ത് കഴിഞ്ഞാൽ നമുക്കതൊരു ഇൻറ്ററാക്റ്റീവ് ആയിട്ടുള്ള ഒരു സെഷനകത്തേക്ക് നമുക്ക് പോകാം. നിങ്ങളുടെയും ക്ലൈമറ്റ് എക്സ്പീരിയൻസുകളും. സോ ഇറ്റ്സ് ക്വൈറ്റ് ക്ലൗഡി, ഇറ്റ്സ് റെയിനി. അപ്പം നമുക്ക് എപ്പോഴും റെയിൻ ഒരു സന്തോഷമാണോ എന്ന് ചോദിച്ചു കഴിഞ്ഞാൽ, കഴിഞ്ഞ തവണത്തെ നമ്മുടെ ഒരു മെസ്സേജിനകത്ത് കണ്ട പോലെ എല്ലാ സൗകര്യങ്ങളിലും ഉള്ളവർക്ക് മഴയൊരു ക്ലാരയാണെന്നും ഒന്നുമില്ലാത്തവരുടെ നെഞ്ചിലെ തീയാണ് മഴയെന്നും ഒരു കമൻറ്റ് നമ്മൾ കണ്ടായിരുന്നു. ഒരു വാട്സാപ്പ് മെസ്സേജ് കണ്ട്. ശരിയാണ്. അപ്പോൾ നമുക്കിപ്പം എന്താണ് അത്ര ഒരു എനർജറ്റിക് ആയിട്ട് തോന്നുന്നില്ല. കാരണം ഭയങ്കര ക്ലൗഡി ആയിട്ട് ഇരുട്ടടച്ച് ഒരു ഭയങ്കരമായിട്ടുള്ളൊരു രീതിയിലുള്ള ഒരു ക്ലൈമറ്റാണ് നമുക്കിപ്പോൾ കിട്ടുന്നത്. അപ്പം അതിന് കുറച്ച് അപ്പം നമുക്ക് അതിനെ ഓവർകം ചെയ്യാനായിട്ട് എന്ത് ചെയ്യാം? നല്ലൊരു ചായയൊക്കെ കുടിച്ചുകൊണ്ട് എല്ലാവരും ലൈവൊക്കെ വാച്ച് ചെയ്തോളൂ. അപ്പോൾ നമുക്ക് ലൈവിനകത്തേക്ക് പോകാം. ഇന്നിപ്പോൾ നമുക്ക് കിട്ടിയേക്കുന്നത് നമ്മുടെ ഒരു കുട്ടി ഒരു സ്റ്റുഡൻറ്റ് തന്ന ക്വസ്റ്റ്യനാണ്. അത് കാരണം ഞാനിപ്പോഴും നിങ്ങളുടെ അടുത്ത് പറയാറുണ്ട്, യു കുഡ് സെൻഡ് മീ യുവർ ക്വസ്റ്റ്യൻസ്, എനി സോർട്ട് ഓഫ് ക്വയറീസ് ഓർ കൺസേൺസ്. കുറേ പേരൊക്കെ നമുക്ക് അയച്ചു തരാറുണ്ട്. അപ്പോൾ അതിനകത്ത് നമ്മൾ സോർട്ട് ചെയ്തിട്ട് നല്ല ഇമ്പോർട്ടൻ്റ് ആണെന്ന് തോന്നുന്ന ക്വസ്റ്റ്യൻസ് ആയിരിക്കും നമ്മൾ വെർച്വൽ ക്ലാസ് പ്രസൻറ്റേഷനായിട്ട് നിങ്ങൾക്ക് കൊണ്ടുവരും. ദാറ്റ് I want all of you to share that. Okay, please give a like, you can comment, and you can share, and you can subscribe this one. Okay, so I want all of you to share this to those who are needy. Okay, ഏറ്റവും കൂടുതൽ ആവശ്യമായിട്ടുള്ളവർക്കെല്ലാം എന്ത് ചെയ്യണം? നിങ്ങളതൊന്ന് ഷെയർ ചെയ്യണം. Okay, so today's question, I'm not going to discuss anything else because we haven't got any other concerns regarding warm-ups or other things. So if I'm getting the questions, I'll be discussing those concerns of yours. Okay, എനിക്ക് കിട്ടുന്ന മുറയ്ക്ക് നിങ്ങൾക്ക് ആ ക്വസ്റ്റ്യൻസ് എല്ലാം ഞങ്ങൾ ഡിസ്കസ് ചെയ്ത് തരുന്നതായിരിക്കും. അപ്പോൾ നമുക്ക് എന്ത് ചെയ്യാം? ഇന്ന് ഇപ്പോൾ നമുക്ക് നമ്മുടെ ക്വസ്റ്റ്യനിലേക്കായിരിക്കും നമ്മൾ ഡയറക്റ്റ് പോകുന്നത്. സോ ബിഫോർ ദാറ്റ് ഐ വുഡ് ലൈക്ക് ടു എക്സ്റ്റെൻഡ് മൈ ഹാർട്ട്ഫെൽ താങ്ക്സ് ടു മൈ ഡിയർ കൊളീഗ്സ് മിസ്റ്റർ വിപിൻ ആൻഡ് മിസ്റ്റർ ജോബിൻ ഫോർ ദെയർ എൻലെസ് സപ്പോർട്ട് ഫോർ മേക്കിംഗ് ദിസ് സെഷൻ പോസിബിൾ. ജോബിനും വിപിനും കൂടാണ് ഇന്നത്തെ സെഷൻ ഹാൻഡിൽ ചെയ്യുന്നത്, ആൻഡ് മിസ്റ്റർ അജീസാം. അപ്പോൾ എല്ലാവരും കൂടെ ചേർന്നിട്ട് നമ്മുടെ സെഷൻസ് വളരെ നന്നായിട്ട് കൊണ്ടുപോകാൻ ഒരു ഹാർഡ് വർക്ക് ചെയ്യുന്നുണ്ട്. സോ ഹാറ്റ്സ് ഓഫ് ടു ഓൾ, ആൻഡ് ഐ വിഷ് ടു എക്സ്റ്റെൻഡ് ഗ്രാറ്റിറ്റ്യൂഡ് ഓൺ ബിഹാഫ് ഓഫ് യു ടു. നിങ്ങൾക്ക് എല്ലാവർക്കും വേണ്ടിയിട്ട് ഞാൻ അവർക്ക് നന്ദി പറയുന്നു. അപ്പോൾ നമുക്ക് എന്ത് ചെയ്യാം? ഫസ്റ്റ് നമുക്ക് ക്വസ്റ്റ്യനിലേക്ക് തന്നെ പോകാം. നിങ്ങൾക്ക് ഐ വോണ്ട് ഓൾ ഓഫ് യു ടു ഗീവ് കൊമെൻറ്റ്സ്, സജഷൻസ് ആൻഡ് ഓൾ. സോ പ്ലീസ് ഡു ദാറ്റ് സോ ദാറ്റ് വി ക്യാൻ മേക്ക് ഇറ്റ് ആസ് എൻ ഇൻറ്ററാക്റ്റീവ് ഇൻട്രസ്റ്റിംഗ് സെഷൻ. ഓക്കെ ഓൾ ഓഫ് യു? യെസ്. സോ ഇപ്പോൾ തന്നെ നമ്മൾ ക്വസ്റ്റ്യൻ ഡിസ്പ്ലേ ആണ്. ഡയറക്റ്റ്ലി നമ്മൾ റോൾ പ്ലേയിലേക്ക് പോവുകയാണ്. ഓക്കെ ജോബിൻ, യു ക്യാൻ പുട്ട് ദ ക്വസ്റ്റ്യൻ. അപ്പോൾ എന്തെങ്കിലും കാര്യങ്ങളൊക്കെ ഉണ്ടെങ്കിൽ നിങ്ങളെല്ലാവരും എന്ത് ചെയ്യണം? കമൻറ്റ് ചെയ്യണം കേട്ടോ. Yes, my dear students, OET aspirants. Okay, so മക്കളെ നിങ്ങൾ ആ ക്വസ്റ്റ്യനകത്തൂടെ പോകുക. I want all of you to read that question. This question is quite heavy. I know that. I want all of you to take the screenshots. You could zoom it up, okay, to have a clear visualization. Actually, it was sent to me by one of our students. Okay, so the common concern of our students was like, how to deal with such a question. ഇങ്ങനൊരു ക്വസ്റ്റ്യൻ വന്നു കഴിഞ്ഞാൽ, സി ഇറ്റ് ഈസ് എ ബൾക്കി, ഹെവി, ജൈജാൻറ്റിക് ക്വസ്റ്റ്യൻ ദിസ് വൺ ഈസ്. കണ്ടല്ലേ, ആ ക്വസ്റ്റ്യൻ ഒരു 1.5 ഏക്കർ തന്നെ ഉണ്ടെന്നാണ് ആ കുട്ടീൻ്റെ അടുത്ത് പറഞ്ഞത്. സാറേ ഇങ്ങനൊരു ക്വസ്റ്റ്യൻ വന്നു കഴിഞ്ഞാൽ ഞങ്ങൾ എന്ത് ചെയ്യും എന്നുള്ളൊരു കൺസേൺ ആണ് അതിനകത്ത് വന്നത്. വാട്ട് വിൽ വി ഡു? ഓക്കെ, വാട്ട് ഷുഡ് ഐ ഡു? ഓക്കെ, വാട്ട് ക്യാൻ ഐ ഡു? എന്നൊക്കെ ഇങ്ങനെ പല കൺസേൺസും നമ്മുടെ സ്റ്റുഡൻസിനുണ്ടാകും. അപ്പോൾ ഇങ്ങനൊരു ക്വസ്റ്റ്യൻ വന്നു കഴിഞ്ഞാൽ നമ്മൾ എന്ത് ചെയ്യണം? ആരെങ്കിലുമൊക്കെ ഉണ്ടെങ്കിൽ നിങ്ങളൊക്കെ ഒന്ന് കമൻറ്റ് ചെയ്തേ, നിങ്ങളൊക്കെ ഒന്ന് റെസ്പോണ്ട് ചെയ്തേ. ഓക്കെ മൈ ഡിയർ സ്റ്റുഡൻസ്. ഓക്കെ, അപ്പോൾ ഇങ്ങനൊരു ക്വസ്റ്റ്യൻ വന്നു കഴിഞ്ഞാൽ നമ്മൾ എന്ത് ചെയ്യണം എന്നാണ് ചോദിച്ചേക്കുന്നത്. ഇങ്ങനൊരു ക്വസ്റ്റ്യൻ എക്സാമിന് വന്നു കഴിഞ്ഞാൽ വാട്ട് വി വിൽ ഡു ജനറലി? there is nothing to do. നമുക്ക് ബോധം കെട്ട് വീഴാനോ ഒന്നും പറ്റത്തില്ല. ഓക്കെ ഓക്കെ, ഇറങ്ങി ഓടാൻ പറ്റുമോ? ഒന്നും പറ്റത്തില്ല. പേടിച്ച് വിറക്കാൻ പറ്റുമല്ല. സോ ഇഫ് യു ഗെറ്റ് സച്ച് ക്വസ്റ്റ്യൻസ് ലൈക്ക് ദിസ്, you're bound to answer that questions because you're there for an examination. So you cannot tell like this sort of questions could come or should come. We cannot tell like that. Whatever the question is there, we are supposed to answer that one. Okay, ഏത് ക്വസ്റ്റ്യൻ ചോദിച്ചു കഴിഞ്ഞാൽ നമ്മൾ ആൻസർ ചെയ്യാൻ ബാധ്യസ്ഥരാണ്. ആൻഡ് ഇത് വായിച്ചു കഴിഞ്ഞപ്പോൾ once after going through these questions, I feel like this is quite bulky, heavy question ആണ്. So many things are there and it is very tough to have an overview within the within that 3 minutes. It is very tough to go through that question even with that 3 minutes. I don't think 3 minutes would be enough for you to go through this topic and to assess and to analyze this scenario. Okay, അപ്പോൾ പക്ഷേ എന്നിരുന്നാലും whatever the situation may be, you are bound to answer this question. You should read, you should you should learn how to utilize this time, especially when it comes to questions like this. ഇതുപോലത്തെ ക്വസ്റ്റ്യൻ വന്നു കഴിയുമ്പോൾ അത് എത്ര ബ്യൂട്ടിഫുൾ ആയിട്ട് ചെയ്യാവുന്ന നിങ്ങൾ എന്ത് ചെയ്യണം? അത് you have to be very careful. Never get scared, never get panic, never get anxious, because that all could put you in trouble. Okay, if you get panic anxiety, if you are trembling with fear, no, that all doesn't help you for your examination. That will make you into trouble. Okay, you will not be able to answer. So just relax, stay calm, read the question properly. Take that 3 minutes, read it properly, see the contents, organize it properly. So if you want to scribble something, you can write the notes over there and you can deliver your speech. Okay, നിങ്ങൾക്ക് നിങ്ങളുടെ conversation start ചെയ്യാം. Okay, all of you, so let's go through the question. അപ്പോൾ എല്ലാവരും എന്ത് ചെയ്യാം? നമുക്ക് ആ ക്വസ്റ്റ്യൻ ഒന്ന് വായിക്കാം. It's quite a heavy question but will make you learn. Okay, ഇങ്ങനെയുള്ള ക്വസ്റ്റ്യൻസ് വരുമ്പോൾ മക്കളെ നമുക്ക് എന്താണ്, we are answerable to all these questions. Okay, so you should learn. So heavy ആയിട്ടുള്ള ക്വസ്റ്റ്യൻസ് വന്നു കഴിഞ്ഞാൽ you could combine 2 or 3 tasks. Okay, 1 or 2 tasks, or maximum you can combine 2 tasks and can answer. It is not necessary to elaborate each and every task. Okay, ഒരെണ്ണം തന്നെ നമ്മൾ elaborate ചെയ്തുകൊണ്ടിരിക്കരുത്. Try to learn how to combine 2 or 3 tasks at a time. If you are getting multitask questions or n number of task questions, if you are getting, means you should learn how to combine 2 or 3 tasks together and you should give a conversation. Okay, ഒന്നോ രണ്ടോ ടാസ്കുകൾ അങ്ങോട്ടും ഇങ്ങോട്ടും കമ്പൈൻ ചെയ്ത് ഫാക്ച്വലായിട്ട് ഇൻറ്റോണേഷനൊക്കെ ഉപയോഗിച്ച് നാച്ചുറലായിട്ട് കോൺവെർസേഷൻ കൊടുക്കുക എന്നുള്ളത്. ഓക്കെ, all of you come, let's check this question. നമുക്ക് ഈ ക്വസ്റ്റിനകത്തേക്ക് പോകാം. സോ സെറ്റിംഗ് ഇസ് എ ക്ലിനിക്കാണ് സെറ്റിംഗ്. യു സീ സൺ ഓർ ഡോട്ടർ ഓഫ് ആൻ 80-year-old patient who is due to have some routine blood tests. She hates having blood taken. The son or daughter is not very happy with the frequent blood tests being done and wants to know if the tests are necessary, which they are. The mother is not present. So always I say, like, along with this setting and scenario, you need to see the first task, because always this first task gives you a clue like how to start, and even if we will be able to know whether it should be taken in a known or an unknown format. So along with this setting scenario, you should see that first task. You should read that first task so that the first task itself will give you a clue, a hint, like whether it should be taken in a known format or an unknown format. Okay, നമ്മൾ സെറ്റിങ്ങും സിനാരിയോയും, ദാറ്റ് മീൻസ് റോൾ ഡിസ്ക്രിപ്ഷനും ചെയ്യുന്നതിനോടൊപ്പം തന്നെ നിങ്ങൾ എപ്പോഴും എന്താണ് ഫസ്റ്റ് ടാസ്ക് കൂടെ ഒന്ന് വായിച്ച് നോക്കുക. സോ ആ ഫസ്റ്റ് ടാസ്ക് കൂടെ റിലേറ്റ് ചെയ്യുമ്പോഴത്തേക്ക് നമുക്ക് മനസ്സിലാകും ഇതിനെ ഏത് രീതിയിലാണ് കൊണ്ടുപോകേണ്ടതെന്ന്. ഓക്കെ മൈ ഡിയർ സ്റ്റുഡൻസ്, യെസ്. ഓക്കെ, സോ ഇവിടെ എന്ന് പറഞ്ഞാൽ ക്ലിനിക്കാണ്. ദ സെറ്റിംഗ് ഇസ് എ ക്ലിനിക്. Son or daughter depends upon the individual examiner or interlocutor. 80-year-old patient. Okay, so mother is the patient. Okay, it's a female lady. She's a lady, an older lady is the patient. 80-year-old patient. So is due to have some routine blood test. So this particular patient is undergoing some routine blood test. Okay, but this patient hates having this blood taken. Okay, actually she's really she's not happy in taking this frequent blood sampling. Okay, she hates that. The son or daughter is not happy with the frequent. Okay, at the same time the mother also hates, or the son or daughter also hates, whoever it is, that mother's son or daughter, whoever it is, or the interlocutor, who is playing that role, no, the bystander or whoever it is, that person also hates taking this routine sampling, okay, hates this routine sampling, that means drawing of blood. Yes, and they want to know whether these tests are necessary. So, their concern is like whether these tests are necessary. So, in the absence of that mother, we are going to discuss the issues. Okay, amma avade present alla. So, in the absence of that mother, we are going to discuss. So, this is a clinic. The bystander is here for some clinic actually it is. So, we could take it as a okay. So, the setting is a clinic and the scenario is given, the bystander has come in search of all these queries. Okay. Find out the reason for the request to see you. So, since it is a clinic and all the descriptions are given in an indirect format, you can definitely take this as an unknown case. You can confirm the identity, you can ask for, you can go for asking the name and can continue the topic. Okay. നമുക്ക് എന്ത് ചെയ്യാം, ഒരു പ്രീ അപ്പോയിൻമെൻറ്റോ അങ്ങനെ ഒരു റുട്ടീൻ എന്താണ് ഒരു ഫ്രീക്വൻ്റ് ആയിട്ടുള്ള ഒരു വിസിറ്റിങ്ങോ അങ്ങനെ ഉള്ളതല്ലാത്തത് കാരണം വി കുഡ് ടേക്ക് ഇറ്റ് എസ് ആൻ അൺനോൺ കേസ്. നമുക്കിതിനെ ഒരു അൺനോൺ ഫോർമാറ്റിൽ എടുക്കുന്നതായിരിക്കും എന്താണ് നന്നായിട്ട് പോവുക. ഓക്കെ, ഇന്നത്തെ കൂടുതൽ സ്യൂട്ടബിൾ ആകുന്നത് വി ക്യാൻ ടേക്ക് ഇറ്റ് എസ് ആൻ അൺനോൺ കേസ്, ഫ്രഷ് കേസ്, ജസ്റ്റ് ലൈക്ക് a routine clinic. It's a clinic visit, not an admitted patient. So, we are just confirming the patients why they have got this request to see us. Okay, so as an unknown case, you can start this conversation. നിങ്ങൾക്ക് എന്ത് ചെയ്യാം, ഇതൊരു അൺനോൺ ഫോർമാറ്റിൽ കൊണ്ടുപോകാം. Explain the need to have regular blood checkups. Okay, so at the same time, we need to ask them, okay, why it is necessary to, because they will be asking why to make her suffer by this routine blood test. Okay, so we need to explain what is the reason. See, the general state of health, functioning of kidney, liver, internal organs, impact of current medication. Okay, explain blood tests are a part of routine health check. So, why this frequent tests are done means it is a part of routine health check. Okay, blood pressure, cognitive function, everything we could assess. Find out whether they have any further concerns. Even after explaining all these things, we need to see whether they have got any more concerns. Okay, explain that slight bruising is to be expected, especially in older patients. So, another concern is like the patient is getting bruises, scars and all. Okay, so blood draw jaim. So, while poking or while pricking, no, this sort of scars and this bruises could happen. So, we need to give the reasons like veins are fragile. Okay, pricking to the test may lead to rupturing of tiny veins. Okay, less pronounced veins, because these are not this is not a projected one, not this is not visible. In some cases it would be less pronounced, usually harmless and fades quickly. Okay, so at the same time we need to reassure them like these are usually harmless and fades quickly. Reassure that you will ask your colleagues to be a lot more gentler next time a blood test is done. So, at the same time we can boost their confidence by saying that we can ask our staff to be more kinder and gentler with the client. Okay, so that staff, we are not actually blaming the staff, instead we are just asking them to be more kinder and gentler. Okay, yes, next is like give details of all. So, explain that there is no need for any treatment for this bruising. Ask the daughter to talk to the doctor if they feel the bruising is too much. Okay, so at the same time they may ask you, they may ask whether they can take some treatment for this bruises, but we can make them know that actually there is no need. In case if they are more concerned, they can check it with the doctor. Okay. Yes, give details of fasting requirements. Okay, so the patient for this routine blood test, they will be having concerns regarding fasting. Okay, because the patient is having other medications, so whether to give food or not. Okay, give details of fasting. Stress that routine medicines are to be taken along with water. So, at the same we have to inform them that the patient can consume all the medications, routine medications as per the doctor's order, but only water should be allowed. No other food or other materials are or other eatables, edibles are not allowed. That we need to inform them. Explain the need for a GP appointment. Okay, so at the same time we need to discuss the need, but that means once after this blood test is done, treatment discussion, results, review medication. So, we can ask them to take an appointment. Recommend son or daughter involvement. So, whenever the patient comes for assessment or whenever the patient goes for appointment doctor, we have to ensure the bystander's presence. Okay, hi Bonnie. Okay, so at the same time we need to ensure the bystander's presence for all these times. Yes, next one is like confirm that it would be a good idea to have the mother along with them for next review, as she would be able to hear and understand if there are any medication adjustment or alterations. Okay, so they will be asking whether they could take their mother along with you, okay, along with them during this appointment. So we can just appreciate the decision to bring their mother to this follow, because the mother could have more idea regarding this discussion, treatments, medications and all. That's all about the question. Appo question ellarkum clear aanennu thonnu. Okay, I hope the situation is clear to one and all. So if you have got any queries regarding the question, please tell me. Okay, I don't know whether no one is much interacting, but I will be just giving you the dialogue. See, it took nearly 10 minutes for us to go for this question discussion. 10 minutes തന്നെ നമുക്ക് ഈ question discussion തന്നെ നമുക്ക് വന്നിട്ടുണ്ട്. അപ്പോൾ എന്ത് ചെയ്യാം, നമുക്ക് ഇതിനകത്ത് എന്താണ്, ഗുഡ് ഈവനിങ് ബോണി, യെസ്, ഓക്കെ, നമ്മൾ എന്ത് ചെയ്യണം, so you have to be fast enough to go through this question. Okay, make sure that speed and accuracy, you need to you have to be very speedy while assessing the question. If this sort of bulky or gigantic or heavy questions like this comes, or multitask question or n number of task question comes, you need to be speedy in assessing this question. Okay, that means the scenario role play, because it takes some time. At the same time, you have to be accurate while reading. In haste and hurry, never miss any of those points and never misinterpret any of those ideas which is given, because that could lead you to have some topic deviation. Okay, so that could be penalized. Okay, if you are in hurry means you could end up in some sort of troubles, that may, because some sort of misunderstanding could come when it comes to while reading these questions. Okay, misinterpretation, misunderstanding, okay, or some false ideas. Okay, so get enough patience, stay relaxed, stay calm, go through the question from setting till bottom. Okay, you need to setting scenario on task from top to bottom. You need to assess the question properly, critical appraisal of the question, organize the things, scribble the notes and carry out your conversation. Okay, അപ്പോൾ എന്ത് ചെയ്യണം, നിങ്ങൾ ഈ പറഞ്ഞ കാര്യങ്ങളെല്ലാം എല്ലാവരും ചെയ്തോണം. Okay, so shall we go to the question role play discussion? നമുക്ക് role play discussionലേക്ക് പോകാം. If you all are ready means just give me some comments. Okay, I'm not getting any interaction from my dear students. Okay, അപ്പോൾ നമുക്ക് ഇതിനകത്ത് എന്ത് ചെയ്യാം, ഞാൻ നിങ്ങളുടെ അടുത്ത് ആദ്യം തന്നെ പറഞ്ഞു, വി കുഡ് ടേക്ക് ഇറ്റ് എസ് ആൻ അൺനോൺ കേസ്. നമുക്കിതിനെ ഒരു അൺനോൺ പെർസ്പെക്റ്റീവിൽ എന്താണ് ഫ്രഷ് കേസ് ആയിട്ട് എടുക്കാം. ഓക്കെ, അപ്പോൾ എന്ത് ചെയ്യാം, നമുക്ക് ഇതിൻ്റെ role play discussion start ചെയ്യും. So whatever the wishes, you could give the particular time of the day that you are attending the examination, you can just give that time indication as your wish. Okay, so now what we can say, like, good afternoon. Okay, good afternoon, please come in, have your seat. My name is Abhilash. I am the charge nurse here in this clinic. How may I help you? So this is a common sort of general introduction. So while saying good evening, good afternoon, good morning, make sure that you are just giving that pulse, that vibe. Okay, never cry good evening, good afternoon, never do all these things. Okay, never get disappointed. In a disappointing ways, you should never offer this wish. Instead, good afternoon or good evening, please come in, have your seat. I am Abhilash, the charge nurse in this clinic. How may I help you? How may I help you? Okay, so the patient will be answering like, nurse, I am here for my mother, my name is Martin. Okay, every role play I am taking this Martin because I am much comfortable with this name. Okay, nurse, my name is Martin, I am here for my mother. Okay, my name is Martin, I am here for my mother. She is due to have some blood test, but I am really disappointed, but I am really not happy with this blood test. Okay, so I want to know more about that. I am here to get some clarifications regarding my mother's blood test and other assessments. Okay, then how we need to appreciate that patient's, that bystander's presence. Pleasure meeting you, Martin. Pleasure meeting you, Martin. Okay, I am happy that you are here for your mother, but it seems you are quite upset. Tell me what actually is bothering you regarding your mother. Okay, or we can ask like, can I have her basic details please, or if you have got her documents, please give it to me. Okay, pleasure meeting you, Martin. I am happy that you are here for your mother. Okay, I appreciate your concern. All those things you can say, like, pleasure meeting you, Martin. I am happy that you are here for your mother. Well, can I have her basic details please? If you have got her health documents, get it to me, please get it to me. Okay, so this is the way by which we are appreciating their presence and we are asking for the patient's details. Okay, so they will be here, the nurse, here is my mother's documents. Thank you. So, they will be giving you the documents. We are appreciating that. Thank you, Martin. Yes, I know that your mother is due to have some blood tests. She is here for some routine blood tests. What happened? It seems you are really upset. What happened? What is bothering you? Okay, why are you upset regarding this? Tests and evaluations. Why? What happened with you? What is bothering you regarding this blood test? Well, it's clear that your mother is due to have some tests done. Yes, she is here for some routine blood tests. What is bothering you? Why you are upset regarding? Why? It seems you are upset. We can appreciate. Well, Mr. Martin, I know that you are quite upset regarding your mother's blood test. Tell me what is bothering you. It's clear that she is here to. She is due to have certain blood tests. What happened? Why are you upset regarding this tests and assessments? Please tell me. Okay, let me see what actually bothers you. So, this is how we can just appreciate. Okay, so this is how we need to appreciate that patient's mind state or mental status. Okay, it's clear, all of you? Yes, my dear students. Okay, so we have just appreciated that patient's concern. Yes. They will be again saying like, nurse, I told you, no, this frequent blood tests, I don't know why actually is this has been done for her. I don't know why this frequent blood test is being done for her. Okay, so what is the purpose of that? She's 80-year-old. Okay, so why to make her suffer? I'm really upset with that. Okay, so the bystander will be saying this. So, that is what here we comes to the second task. Yes, Martin, I understand. I know that you are overly concerned regarding your mother, but as you said, you have to be mindful of her age and present status. Okay, she is 80. She is in her advanced age. See, there are certain things that you need to be mindful of. As you said, your mother is in her 80s, okay, she is of advanced age. So, nowadays it is very important to have this test done. Okay, blood test will give a clear idea regarding her body functions, especially internal organs, I mean kidney, liver, heart, okay, and other internal organs. Okay, so we could even assess the impact of current medications. Effectiveness of current medication could also be assessed if these blood tests are done. Okay, so this is how we are going to convince the patient. Okay, yes, and see, these are part of routine health check. Okay, this is a part of routine health check, and it is indeed very important for elderly patients to have this routine. It is indeed very important for elderly patients to have this blood test. Okay, so this is a part of their routine health checkup. Okay, we would be able to assess her blood pressure. Okay, so nowadays hypertension, diabetes and all is very common lifestyle disorders. So, we will be able to assess blood pressure and even the cognitive functions. Cognitive function means memory, okay, orientation, okay, language, okay, all those things we could be able to assess the brain functions to cognitive functions to, I mean memory, orientation, language, her skills and all, motor skills and all, we will be able to assess all those cognitive functions too. Okay, so it is indeed very important to have this blood test done. Okay, we will be able to act in advance in case if some anomalies are detected. We would be able to act in advance in case if some anomalies are detected. Are you getting me? Okay, so never say no to the blood test. Okay, never say no to this routine health checkups. All right, Mr. Martin. Okay, all right, Martin. So, they will be saying like, yes, nurse, any other thing, any other queries or any other concerns for you? Do you wish to ask anything? Is there anything else that is confusing you, or is there anything else that is bothering you? Yes. So, they will be asking like, nurse, again I want to tell you that this sort of bruises, okay, she has got certain sort of injuries and some sort of scars, marks and all over her body. So, that is what I am again that I am upset with. This is what I am again upset with. So, they will be explaining the factor. there. Actually, we cannot deny that situation because that may happen. Bruises, scars, injury and other marks will be there following this sampling. Okay, while during this sampling or following the sampling, bruises and all are common. So, we need to accept that situation and should, yes, I know it is quite hard to have this bruises. Okay, yes, I know, I accept what you say. Okay, yes, I know, you are correct, I agree what you say. Okay, I agree to your say. I will agree what you said. Okay, it is correct. Okay, I agree to you. Yes, I know, I value your feels. You are correct. You are true. Oh, I agree to your says. There could be some sort of bruises. There could be bruises following this sampling. Sampling in the sense drawing blood. Okay, there could be some bruises following this, especially in older patients. There could be some bruises following this sampling because they are old. Okay, the prime reason is like they are old. Okay, the veins are quite fragile, thin. Okay, the veins are quite fragile and thin, and the risk for bleeding is more. Okay, rupturing of blood vessels could happen and the risk for bleeding is more. Okay, so we cannot have this sort of pronounced veins. Okay, we cannot have pronounced veins among elderly clients. We cannot have pronounced veins over elderly clients. Okay, so that is quite happening with them, and you don't have to worry about these bruises. These are usually harmless. It will go away by itself. It will go away by or fades quickly, or it will go away by itself. Well, Martin, I appreciate. Yes, I agree. I agree to your says. You're true. Okay, I agree what you say. Okay, yes, there could be some sort of bruises following, especially in there could be bruises, injuries. Okay, there could be bruises while poking or breaking or while following the sampling. There could be bruises and other scar marks. That is quite usual. It may happen more among elderly clients because their veins are very tiny, fragile. Okay, so we cannot have this sort of we cannot have pronounced veins among elderly. So that is the reason they are having this sort of bruises, but you don't have to worry about, nothing to be overly concerned. These are quite usual. These are usually harmless and will go away by itself. These are usually harmless and will go away by itself. Okay, and hereafter I will definitely ask my colleagues. Okay, hereafter I will definitely ask my colleagues to be more gentler and kinder with the patient. Okay, hereafter I will ask my colleagues to be more gentler and kinder with the client. Okay, hereafter I will ask my colleagues to be more kinder and gentler with your mother or clients. Okay, are you okay? Are you okay? Or how does that sound? Are you okay? So they would be obviously saying like, yes, nurse, that's fine. Okay, do I need to take some treatment for this bruises, nurse, or something like that? No, nothing. No, not at all. Okay, it's not necessary. It's really not necessary. No, so they will be asking like, do I need to take my mother for some treatment? Do I need to apply something, or do I need to take some treatment for this bruise? Really, not really necessary. We can answer like, not really necessary. Okay, as I told, it will go away by itself. Okay, it is only for a short term, short duration, it will go away by itself. But if you are more concerned regarding bruises, I will definitely ask you to go to the doctor. Okay, but if you are more concerned regarding the bruises, I would definitely ask you to go to the doctor. You can confirm it with them. Okay, you can confirm it with them. So this is how we cannot give more explanations because our time is only for 5 minutes. Okay, we have got only 5 minutes. We are having only 5 minutes for our presentation. So try to touch the things and move from one task to another. Okay, and again, okay, are you getting me, Martin? So they will be saying like, yes, nurse, see, what about this medications and all? In case if this routine blood tests are done, means we need to take fasting and all. No, we need to, my mother needs to take fasting. No, what about that? Yes, it is very important. Okay, for certain blood tests, fasting is very important, especially when it comes to diabetes mellitus, okay, blood sugar evaluation and all. Fasting is very necessary. Make sure that the mother is there in fasting for 8 hours. Okay, so they have, okay, your mother needs to have this fasting 8 hours prior. Okay, she should avoid food. So she should avoid this food and should attend this. Okay, it should be Otherwise, you can make the sentences like, yes, it is very important, fasting is very necessary, they should start fasting 8 hours prior. Okay, your mother should start fasting 8 hours prior. Okay, it is important to have this fasting 8 hours prior. So, in a simple sentence, you could start like that. Okay, yes, it is very important, fasting is very necessary, especially in case of blood evaluation related to diabetes mellitus, blood sugar and all. So, make sure that your mother needs to take fasting 8 hours prior. Okay, okay, she has to be in fasting for 8 hours prior. Okay, she has to be in fasting for 8 hours or prior 8 hours. Okay, you can say like that. Okay, it is very important to have this fasting 8 hours prior. Oh, that is how we could construct that statement. Okay, but you don't have to worry. You can administer the routine medications. But you don't have to worry. You can administer the routine medication. Whatever the medication she is taking, you can continue that, but never give any food. You can administer it along. You can administer it along with water. Okay, but you don't have to worry regarding the medication. Never stop any of those routine medication. Instead of food, you can administer the medications along with water. Instead of food, you can administer the medications along with water. Clear? Okay, got it. This is how you should ask for their understanding. So, the patient would be saying like, okay, as bystander or the interlocutor would be saying like, oh yes nurse, I am getting you. Okay, what is to be done following the blood test? They will be again asking, oh nurse, what should be done after this blood test? Once this blood test is done, okay, once after the evaluation, you will be intimated regarding, you will be given an intimation regarding the blood test results. Okay, once after this blood test, once after this sampling, you will be intimated, or you will be having an intimation regarding, you will be having an intimation regarding the blood test results. You can come and collect the results and make sure that you are taking an appointment with the general practitioner. Okay, and make sure that you are taking an appointment with general practitioner for your mother. Okay. Yes, following the sampling, it will be taken to evaluation. Well, Mr. Martin, following the sampling or following the blood test, it will be taken for evaluation. Once after this results are out, you will be given an intimation. Once after this results are out, you will be given an intimation. Once after this results are out, you will be given an intimation. You can come and collect the results and make sure that you have got an appointment with the GP too for your mother, and make sure that you have got an appointment with the GP for your mother. You have got an appointment with the GP. Okay, so that you can discuss the treatment, okay, and can evaluate the results and can review the medication. So, if you take the an appointment with the GP, so definitely there will be, can discuss regarding the treatments or present status, all can be discussed. In case if the review of medication is needed, that is also possible. Are you getting me? Following the sampling, it will be taken to evaluation. So, once after the results are out, you will be given an intimation, can come and collect the results. Okay. At the same time, make sure that an appointment is done for the GP. At the same time, make sure that an appointment is done for the GP for your mother. Okay. An appointment is done with the GP for your mother. At the same time, make sure that an appointment is done with the GP for your mother. Okay, so you can discuss the results and treatment. Okay, in case medication review is needed, you can do that too. Okay, so medication review is also possible in that follow up. Yes, and make sure that whenever your mother is here for assessment or for blood evaluation, I want her to be accompanied by someone. And don't forget, your mother has to be accompanied by someone at the time of her visit. Okay, for this, while she attends for blood tests and follow-up appointment, make sure that she is accompanied by someone. And Martin, don't forget, your mother has to be assisted at all times, especially when she comes here for blood test and when she is here for follow-up appointment. Make sure that someone is assisting her. She should be assisted by someone. Okay, because especially she is in her advanced stage, the risk of fall, injuries and mishaps are quite high. So, make sure that she is assisted at all times, especially when she comes for follow-up and blood test. Make sure that she is assisted by someone. I want someone of you to be accompanied with her. Okay, I want someone of you to accompany her during her blood test visits or follow-up appointments. Okay, don't forget that. Don't forget that. Every time you cannot, it is not fair to ask like, are you getting me, are you following? Don't forget that. So, they will be saying like, yes, nurse, do I need to? So, again they will be asking like, nurse, do I need to, can I bring my mother along with me for this review, follow up and all after this blood test results? Once after this blood test results, once after this blood test, can I take her along with me? Can I bring her along with me for this review, follow up and all? So, they will be asking you. So, they are confirming, nurse, can I bring my mother along with me for this evaluation, for this follow up appointment? Okay, even though she is old, I feel like taking her with me. So, you can appreciate. Of course, yes, that's great. Of course, yes, that's a great idea. Of course, yes, that's a great idea. You can definitely bring her along with you. You can definitely bring her along with you. Okay, so for follow up, it will help her a lot. She can take part in this discussion. Okay, would be able to understand this modification of medications and review of her health plans properly. Okay, of course, yes. That's great. It's a brilliant idea to bring her along with you. Okay, that will definitely help her a lot. Like that will definitely do a great help. She could understand the treatment plans, review of medications, adjustments or alterations medications. Okay, and even she can have a conversation with the doctor. Okay, all her queries would be alleviated during this session. Okay, all her queries can be alleviated during this session. So, it's a great idea to bring her. You can do that. Please do that. This is how naturally you can convince that bystander or son or daughter to bring her here. Okay, that's it. Of course, yes, that's great. It's a brilliant idea to bring her along with you for this follow-up. That would definitely do a great help. She can participate in her treatment discussions, reviewing of medications. It would be very, should be able to understand better her medication alterations and adjustments. Even she can have a chat with the doctor. She can discuss her queries. Okay, all her worries and concerns would be alleviated during that discussion. Could be alleviated during that discussion. So please do that. Bring her. Okay, so please do that. Bring your mother along with you. Okay, that's a great idea. Please do that. Please do that. So, they will be, oh sure nurse, I will definitely do that. They will be agreeing to you. Okay. Yes, Martin, I am very happy having this conversation with you. I know that you are really very caring and concerned. You are really very loving. Okay, so your mother is blessed to have a loving son like you. You are very caring and concerned. Do you have any other questions for me? Do you have any other questions for me? Okay. So, are you ready for the blood tests? Okay, so they will be saying like, yes nurse, I will definitely bring my mother to the blood test. Everything is clear. Thank you. Thank you for the visit. Okay. Thank you for the visit. Convey my regards to your mother. Okay, thank you for the visit, Martin. Convey my regards to her and bring her here at the correct time for the follow up. Okay, and bring her here at the correct time for the blood test. Okay. Okay, don't forget, Martin, bring her here at the correct time for the follow up. Thank you for the visit. Convey my regards to your mother. Convey my regards to your mother. Just in a normal fashion, yeah, just convey my regards to your mother. Simply you can end up the conversation like that. Yes, that's all. അപ്പോൾ നമുക്ക് എന്താണ് conversation കഴിഞ്ഞു. So overall നിങ്ങൾ ഈ dialogues copy ചെയ്തിട്ട് just see, practice it and see. Put your timer on and practice. Okay, just take this dialogues that I have seen. See, I have repeated it many a time, but you don't have to worry regarding that. Just collect these dialogues from top to bottom, from introduction till conclusion. Take these dialogues, plan it. Okay, set your timer on. Get your timer on and see whether you are able to adjust the points within that time. Definitely you would be definitely able to do it in 5 minutes, I am sure. Okay, just do that. That is how you should practice. Okay, so this is what my request to all of you. Get these dialogues. Okay, set your timer on and practice it. Okay, you can definitely set it for 5 minutes. Within 5 minutes you can finish this. Okay, even though it sounds or it looks like a gigantic topic, when it comes to conversation, see, I have just simplified all those things, but I have gone through all those things. Just collect the dialogues and see. Okay, practice it and see. Okay, any other queries or concerns, you can send to us. We'll be always, you are always welcome. Your doubts, your concerns are always welcome, because that will help us to function more and more better. Okay, so see you all for another virtual platform classroom. See you all on next Friday for this virtual platform classes. Okay, so thank you all for your cooperation. Take care. God bless.